Share an overview of the clinic services, and I'm excited that you're ready and willing to learn more. So without further ado, let's talk about the clinic. So as you already know, the clinic's located just down the hall here on the first floor, and it's open. We have a nurse staffed in there from 8:30 till 4. And that nurse is in there for the first 5 days, and we have weekend nurses that are there on the weekend. So 7 days daily, we have nurses in the clinic. While we do take walk-ins in the clinic, we very strongly encourage appointments because we want to make sure that your wait time is low and also that you get the attention that you need to take care of your medical needs in the clinic. So as you know, the clinic actually works very, very closely in collaboration with your primary care provider. The clinic here is like a bridge between your primary care provider and other providers. They could be specialists, they could be hospitalists, whomever you're going to see. The clinic in Morgan back there is able to help to bridge those services so that you have a continuity of care for your medical needs. So who's a part of the team? So the team is comprised, of course, of Morgan. She's our primary nurse in the clinic. Morgan's been here for 14 years serving you. And then Tamika Brogdon is our medical assistant or care concierge. Tamika's been here for 9 years. And Morgan's backup is down below. That's Laura DeMarco. Laura joined us just about a year or two ago. And Laura is actually the community liaison. So if any of you have gone out to the hospital and come back, you or your power of attorney may have spoken with Laura if you had a need for healthcare services. Tamika now has a backup who's Patty Pascal. I'm sure many of you will know Patty. Patty has been here for 20 years. So between that team, you're looking at a combined 44 years of service to you since being here at the Chesapeake. So we're excited about that team. Now backing those ladies up on the weekend, we have Jackie Merced, who's an RN, as well as Kathleen May. And right now we have Nichelle Broughton. You may have met her on the weekend. She's only here during the weekends. To our dismay, Nichelle has decided to move back home. And home for her is in Georgia. So she's going to have her last weekend with us this coming weekend, and then she'll be moving back to Georgia. So, again, the bridge is connecting all of the primary care and specialty providers. So let's talk now a little bit about how do you know when to go to whom? So primary care physician, of course, is your first line of defense for healthcare needs because that person is the one you've established a relationship with and they know all of your needs, your medications, everything. They know everything about you. And so the primary care physician is the first point of defense for you. Every now and then there may come a time where your primary care physician may not be available when you need him or her, or it may be after hours, and that's where an urgent care center would be a possibility. And then if there is a life-threatening illness or emergency, of course, then you would go to the hospital emergency room. And our wellness center will help you to navigate all of those modes of care. Let's talk a little bit about the primary care physician. What exactly can you expect from a primary care physician? Well, of course, you're going to get your routine visits and checkups there, annual checkups. You're going to have the opportunity to have medication management. If required, you're going to have lab testing and screening, and of course, any type of management of chronic illnesses like diabetes or cardiovascular diseases. Of course, with primary care physicians, most visits are by appointment only, so you would have to schedule adequate time for your unique medical needs. So our medical director can serve as a primary care physician here through our clinic. And as the primary care, all of those services that we just mentioned are things that our physician can handle here. Chronic care management, vaccine administrations, he can do annual visits, all of those same things. And in addition, our medical director can also bill your medical insurance. So just a thought for you about that. So who is this guy I'm talking about? That's no one other than Dr. Haji. You may have met Dr. Haji at some point in your travels, but Dr. Haji's been here with us for a little over 4 years now. He is board certified. He's an internist. He graduated from Ross University, that's in New Jersey. That's the New Jersey School of Medicine. And he completed his internships and residency right here in Eastern Virginia Medical School. So Dr. Haji works very, very closely with a nurse practitioner. And that nurse practitioner is Holly Whiting. Holly has been quite a godsend for us in all levels of care, because when Dr. Haji is not here, he's usually here once a week on Thursdays. When he is not here, Haji is here all the other days. So we have medical coverage 5 days a week here and on-call coverage as needed on the weekends and after hours. So other medical providers that we have here are podiatry services. Right now we use Dr. John Piacenti. And because his name is a little bit challenging, we just call him Dr. John. And he has a business card that says Dr. Five Toes. So he's a hoot. You will have an opportunity to meet him if in fact you would like to have podiatry services. He usually visits here every 90 days or so, but he comes in between as needed for appointments. We just need to know that, or we'll have our residents to be on a list, and then we let you know when he comes. Usually he sees just about everybody in the building on the same day. He comes very, very, very early in the morning and is reserving time toward the early afternoon for our independent living residents, like around 1-ish. So Dr. John, of course you know we still have Rose here as a massage therapist. Now coming really soon is what's exciting for us. Our medical director, Dr. Haji, is continuing to expand his partnerships inside of the group. His group is called Mid-Atlantic Long-Term Care Services. So within Mid-Atlantic Long-Term Care Services, they just recently added on a palliative care specialist, and her name is Dr. Pettyjean. He's also adding on psychological counseling, so we have a social worker who comes out, and he's adding on wound care, and we also are having a new addition to the LifeSpire family with a wound care specialist contract as well. So we'll have wound care specialist backups as we need it, and then physiatry. Physiatrists do pain management, and so the physiatrist is going to be working with Dr. Haji's group as well. So that's just a sneak peek of some of the additional medical providers that will be working with Dr. Haji, and they will be seeing residents out of the clinic if desired. Okay, we talked about that bridge. So the other part of the bridge is urgent care. So if your primary care physician who might be outside of our campus is not able to see you, urgent care is your next best option. Most urgent cares are open from 9 to 9, like the MD Expresses, or 8 to 8, which is like the patient first centers. They're staffed by physicians, nurse practitioners, and physician assistants. And so their services are varied. They can see you for mostly illnesses that are chronic. They can see you for fractures, lacerations, and things like that. Which, if we contrast our wellness center, we're open daily, 8 to 4:30, and we're staffed by just the one clinic nurse at this point. and a medical assistant. I'm sharing this contrast to you because I want you to see the difference in the level of care so that when you have a need, you'll know exactly what to expect between the two different clinics, the wellness clinic here and an urgent care or a walk-in clinic. So our wellness clinic can accommodate services like basic first aid, wound dressing changes, medication box setups. They can do vaccines and labs. For our wellness center, that is basically nurse consulting hours that are private pay. If you were to determine that Dr. Haji is the person that you'd like to have as your primary care provider and you saw him, he would be able to bill your insurance for any services that he provided. He also said that if needed, he can act as an urgent care center in that he can provide same day or next day service if needed, provided it's scheduled early enough. Everybody got all of that? That's a lot of words. You good so far? Okay. So just in a nutshell, the Wellness Center can provide medication packing or sorting. They can hold your pharmacy packages that come in from other pharmacies like Heidenwood or Medigap. Some of you have pharmacy accounts with those pharmacies, and so when the meds are delivered here, the Wellness Center can hold them until you're able to pick them up. And again, basic first aid, wound dressings, flu shots, and if desired, you can have full primary care services through Dr. Haji. So those are the services we offer there. Some services require additional cost, some do not. So the services that require additional cost are consultations, and sometimes the consultations would include wound dressings, might include PTI&Rs, of course, med reminders in home, $5 per occurrence, medication management or pill box setup is done. And then, of course, if one of our drivers has to go out to pick up the prescription for you, there's a charge for that. There are some free services. The free services are vital sign checks, like blood pressure, height, or weight. And in the event that you become ill, there is still the meal delivery service that you're able to get for up to 7 days, 1 meal per day. Okay. There are other offices that are located in our clinical suite, and those would be our chaplain, Dr. Uwe Scharf, the home health and the medical transportation services are in the clinic across the hall from Tamika. Around the corner is the select rehab services. And just for now, our infection preventionist is located also in the clinic. She'll be moving very soon to the nursing admin suites.
I didn't hear what you said. Moving where?
To the nursing administrative suites down the hall. Mm-hmm. So that other end of the bridge, we've talked about primary care, we've talked about urgent care, and then the other part of the bridge is the emergency department. So normally we're able to handle a number of different concerns in collaboration with your primary care. And again, there are times that you might experience a life-threatening emergency, like chest pains or difficulty breathing. We consider that life-threatening. Numbness or weakness on one side or slurred speech, that could be life-threatening because it could be signs of a stroke. The first one, signs of a heart attack. Serious burns, head injury, fever, seizures, excessive bleeding, all of those are life-threatening events that we would strongly encourage one to go out to the hospital for treatment. And so when one goes to the emergency department, our team is going to be listening out to make sure that when you need additional help on your return, that we're helping to coordinate that care. So that is basically the bridge and how the clinic can assist with those services, making sure that in any part of your medical journey that you have the support you need, whether it's from a primary care physician, whether you want to choose the primary care physician that we have here, Dr. Haji in Holly, or whether you have to go out, whether it's an emergency or even a planned procedure. When you return, we'll be able to address the needs and to try to coordinate services for you. So pendants are important too, and the tie with the pendants is that the clinic is in charge of monitoring those alerts from you. The system also monitors the batteries, and when they become low, they will be able to contact you from the clinic. It will probably be Tamika. She will contact you to say, your battery is low. Would you mind stopping by the clinic so that we can replace it for you? We want to try to do that as soon as possible so that we make sure that it doesn't reset and kick you out of the system. So battery replacement for the pendants. We encourage you to wear your pendants at all times. We've noticed that when we can get to you when you're having an emergency event, minutes matter. So if you're wearing your pendant at all times, when you press it, we'll be able to find you if you're on the campus. If you happen to go off the campus for hospitalization or whatever, we encourage you to leave that pendant home so that you won't have to worry about losing it or having to repay if the hospital decides they want to toss it. And then the pull cords are also tied to the alert system that the clinic gets. Each pull cord is located in your bathroom. On the pull cord device itself, there's a black button that you push. And when you push that button, by 10 a.m., you've checked in successfully with Tamika, and you won't have to worry about her bugging you and calling you and asking you if you're okay. If you're expected to be out of town, then you've been doing a great job of sending the notifications to let us know that you'll be out of town so that we're not contacting you or going up to your homes to check to see if you're okay. And then, of course, emergency medical information. So you should have under your kitchen sinks already the information on medications and allergies and who your emergency contact is. And so that information is very important to maintain and be up to date in the event that you would have to go out. If you would like to submit a copy of that to the clinic, you're certainly welcome to do so. The quick note on hospitalizations is if you are hospitalized, we encourage you to notify the clinic, and then the clinic will notify the healthcare team so that we are ready and beginning preparations for your return. We want to make sure that if you need health care or home care or a combination of one or the other with therapy services, that we've begun to prepare for your return. If you have a planned procedure, we also encourage you to contact the clinic, because in the same vein, the clinic will be able to assist you in making those proper arrangements as well to ensure that we have exactly what you need according to your physician's orders when you return. Questions so far?
What is the clinic phone number that should be used?
Very good question, thank you. So the clinic phone number that should be used is extension 1675, so 223-1675. Yes, sir.
The check-in the morning, if you, for some whatever reason, you don't check in and the personnel calls, say, are you okay? Is there still a charge for that? I mean, it came up and then kind of went away, and I'm wondering if that's still there.
It's still in place.
Question?
The question is the charge still in place for check-ins if you miss the check-in time and you have to be contacted by the clinic? So the charges are still in place, yes.
So if they have to make a phone call, it costs us $50. Is that what you're saying?
I don't think it's a single phone call.
And it's after how many misses?
3 misses, after 3 misses, then you see the charge.
It's not the first time, it's when there's a pattern, we're concerned about that pattern.
Is the pendant to be worn in bed when we are sleeping?
It should be accessible. So if you don't wear it when you're sleeping and if you have access to it close by, I think that would be good. We do encourage you to wear it all times because, you know, sometimes if you are in bed or you get up and trip and you fall, you may not have it near. So we do encourage that. Yes, ma'am.
What's the charge for missed call-ins?
It's $50.
Thank you.
Good questions. Other questions? Yes, sir.
Under the free services that the clinic provides, the nurse responds to any pendant request during the daytime.
That is correct.
Is that also under the free services?
That is a free service. Thank you. We will update our slides. So yes, sir.
Is this call-in thing, is this optional?
You can opt out if you
Can opt out?
choose.
Okay.
And I think, Barbara, our response would be for couples, it makes great sense. For an individual, we'll honor that request, but it may not be advisable.
I agree. But if 2 people in the household, I see no need to have
Okay. Did everyone understand that response? Okay. So I'm adding nurse responses during day. What other questions can I answer for you? Are we clear on services from the clinic? So you have the options. You have the option of having a primary care physician that's operating out of the clinic to take the place of a physician. I can tell you that Dr. Huffman, who used to be here and had a practice outside of here, has moved to Suffolk. And several of his patients who lived here have transitioned over to Dr. Haji for the same services so that they can continue following, having a physician follow them, but also have the convenience of having it here, you know, right in their homes and not worry about traveling, you know, being in traffic. Yes, sir.
So I guess Dr. Haji is a potential primary care physician here.
Right.
And then did I hear you mention also that Holly
Yes,
is
sir.
a primary care physician?
She's a nurse practitioner.
Okay, so it's Dr. Haji who's the primary care.
Correct.
Okay.
Right.
And if that, what you're reading into is if Dr. Haji's here on Thursday and he is your physician, but you have an issue on Tuesday and you call down and Holly can see you, you're seeing the nurse practitioner and she's in consultation with the physician if additional services needed or prescription order.
Correct. So they order any types of testing, screenings, labs, And they can, in fact, see you on an annual visit basis. All of those things that a primary care physician can do outside of here, they will be able to do inside of here. So that's an option for you. Whether it's Dr. Haji or your outside physicians, I think that Morgan has done a great job of ensuring that the collaboration is there to get you all of the care, the labs, or other services that you might need to ensure that your medical needs are met. Yes, sir. Yes, sir.
My understanding that the nurse practitioner is here every day until about 1 o'clock.
Mm-hmm. She is here every day. She doesn't stay the full day, but she is here every day until 1 or until all of the needs are met, yes. Mm-hmm. And all she needs to know, or Dr. Haji for that matter, is that we need to have an appointment scheduled for anyone, and they'll be happy to see you. Yes, sir.
Barbara, I believe it's still our recommendation that if a resident needs nurse consultation, particularly in the evening time when our security team is responding to dependents, that they can call the Riverside Nurse on Call.
Yes, good point. So the Ask a Nurse program is still the triage service that's needed, that we use for after hours. So if there is a question after the clinic closes, those triage nurses are RNs that have been trained to do triage, trained to understand what your concerns and symptoms are to provide you the best guidance possible for your after hours care.
And what is the phone number for that?
Ooh, that's a great question. I don't know it off the top of my head, but I'll get it for you.
It is 595-757-595-6363.
Thank you very much. Did you hear that? 757 595 6363. Morgan, what am I leaving out?
Actually, I think
Yes.
So my next question, I'm curious if any resident, through your current primary care physician or your insurance, some of you have alternate programs, do any of you have any experience with telehealth, where in place of calling the Riverside Nurse on Call or trying to get a physical appointment, you're calling in and actually connecting to a physician by Zoom or some other medium? Is that something that I think we have to look at? It may be an alternative to even having available in the clinic, where you could come there and perhaps have a telehealth visit. I don't know whether Haji will consider that, but I think that's another very popular service that's convenient for older adults.
Very good point. We've had a couple of telehealth visits in healthcare, for instance. We've had specialists who have contacted our residents. It might be a counselor or it might be a dermatologist. And the way that it's been done in healthcare is we bring in a laptop or a tablet with a nurse on our end with the patient for the physician, our resident. And the physician on the other end is able to see the resident, ask whatever questions are needed, and receive whatever responses they need as well. There is an additional technology that is coming out where we can actually send our EKG results to the physicians. And so there are a number of different tests that can be done, and a physician who is off-site but zooming in on for telehealth can receive that information and help to make decisions and guide the team here based on the conversations via telehealth that they've had with the residents and the team. So it is a great alternative, especially if residents are not able to be transported, or it's detrimental to their health if they're transported. So telehealth is definitely a good thing to consider. Yes, sir.
Could you also make a point about keeping their information current in the clinic?
Okay.
The kids and the relatives.
Right. So Jess brings a good point up. It's really important to make sure that your information is kept current. So if you have a change in your power of attorney, or if you change, if your children have decided to flip who's primary, we just need to make sure that all of that information is kept up to date. And if you send it to the clinic, they can update it in the electronic medical record for you.
Updated phone numbers.
Oh, and Morgan said updated phone numbers as well. So if you change your phone number, if you change your medical insurance, sending that along to the clinic will be very, very helpful in making sure that we're reaching the appropriate people and we're using the appropriate insurance information.
So how do you update? You do a written form or you do it on the computer? How do we tell you that it's changed?
You can bring the paperwork down.
Morgan says you can bring the paperwork down,
Or back home.
or you can make a call. It's probably most helpful if you bring the paperwork down, because then we'll have a copy to make sure we don't transpose any numbers or anything. Good questions, thank you. Other questions? I know I've forgotten something. What have I forgotten?
I don't think you forgot anything.
There are two associates with Dr. Haji so far. We've not seen Dr. Erdman frequently, but if Dr. Haji goes on vacation, you might see Dr. Erdman, E-R-D-M-A-N. He is also a primary care, well, he's actually an emergency physician that does primary work. So he's great when it comes to being able to respond to, any type of urgent situations that come up, but he is on the medical team with Dr. Haji. So I've given you several names for the Mid-Atlantic Long-Term Care Group, and they're continuing to grow and add on specialties that'll help in our community as well as the geriatric industry in general.
Are you encouraging visits to the other levels of care now, or should we still stay in place here and not visit?
Great question. So visits to other levels of care, we have had to suspend communal dining and activities in healthcare for a little bit. So we'll be sending out some type of notification. More than likely, it's going to be the beginning of the week next week, because we did have another couple of people to get the GI bug. So thank you for asking that question. I believe that assisted living may be clearing. They have to get through the rest of this week and then next week also. Good questions. Mr. Jess, any others?
Well, thank you very much. It's been a great opportunity for everybody to be informed about what's available for our particular needs. We all have